Welcome to the deep dive. Today we're tackling feline gastritis. It's super common for cat owners, but actually the way vets understand it is changing pretty fast.
It really is. Gastritis, just inflammation of the stomach lining. People often just brush it off as a bit of tummy trouble.
Right.
But our mission today is to, well, cut through that. We need to separate the acute, sort of sudden stuff from the chronic, long-term inflammation. And crucially, we're going to look at some, frankly, surprising research that challenges how we've treated it for years, especially in sick cats.
And it's serious, isn't it? This isn't just a bit of discomfort. If gastritis really takes hold, it can cause painful ulcers.
Absolutely. And worst case, if an ulcer goes deep and hits a major blood vessel, well, you're looking at a life-threatening bleed. It's definitely something to take seriously.
Okay.
So to get the full picture, we've pulled info from, various places, vet clinic guides, general pet health articles, but also some pretty dense clinical studies that are really pushing things forward.
Got it. A broad view. Okay, let's start with spotting it. How do you tell if it's just a quick acute flare-up versus that chronic nagging kind? What should people be watching for?
Well, vomiting is usually number one. No big surprise there.
Right.
It might be yellow, like bile, or maybe just undigested food they just ate. But you can't just stop at vomiting. You need to look at the bigger picture. Are they losing their appetite, losing weight? That's often more of a chronic sign.
Yeah, I found those subtle nausea signs really interesting, like the hypersalivation, that foamy drool around the mouth.
Exactly. Or that weird thing where they suddenly start eating loads of grass.
Trying to make themselves sick, maybe.
Possibly. We think it might be an attempt to soothe their stomach or, induce vomiting. And watch for belly pain. Cats hide pain so well.
So subtle signs.
Very subtle. Maybe grinding their teeth or suddenly not wanting you to touch their stomach area.
Okay. And the really serious stuff.
Severe signs, acute or chronic, look similar. Dehydration, being weak or lethargic, sometimes diarrhea, but the absolute emergency, blood.
Blood in the vomit or stool.
Yeah. Fresh red or sort of maroon blood in vomit, or that dark terry stool melena, we call it, that means digested blood. If you see either of those, it's straight to the vet. No delay.
So basically the symptoms can overlap, but it's the duration that clues you in. Quick onset, gone in a few days, likely acute. Lingering for weeks, or come back again and again that screams chronic and needs a deeper look.
You got it. Now, for those acute cases that aren't, super severe, no blood, cat's still reasonably bright, the outlook is usually pretty good. Often, we can sort it out just by, well, letting the gut rest.
Resting means holding back food, right? Which feels wrong to a lot of owners. They want to comfort their cat.
It does feel wrong, but it's crucial. You need to withhold all food for, say, 24, maybe even 48 hours. The stomach lining is inflamed. It needs a break to heal.
And water.
Small amounts of water offered frequently during that first 24 hours. But here's the critical bit. If the cat throws up even that small amount of water, then you stop. You need vet help right away. Dehydration hits cats incredibly fast and hard.
Okay, so assuming they manage 24 hours with no vomiting, keeping water down, how do you bring food back? Carefully, I imagine.
Very carefully, start tiny. A small amount of something really easy to digest, low fat, and think small, frequent meals, maybe 4, even 6 times a day. Start with maybe half their usual daily amount total.
And then gradually increase.
Yeah, slowly increase the amount over the next 2 or 3 days. If the vomiting starts up again when you reintroduce food.
Back to square one.
Back to fasting, and definitely call the vet at that point.
Okay. Now, what if the simple fasting and careful reintroduction doesn't cut it? Or if it was a bad case from the start? What drugs do vets typically use?
First line is usually anti-vomiting drugs, antiemetics, things like Cerenia or maybe ondansetron. They're very effective.
Okay.
If we think there's significant erosion or maybe ulcers, we might add a gastroprotectant. Sucralfate is calming. It kind of coats the stomach lining like a bandage.
Right, like a protective layer.
Exactly. And then acid reducers. H2 blockers like famotidine are used a lot.
Mm-hmm.
Or for really severe ulcer cases, we might go for a stronger proton pump inhibitor or PPI like omeprazole.
And fluids are always key if they're dehydrated, yeah. Sub-Q or IV?
Oh, absolutely non-negotiable. If they're dehydrated, you have to correct that first. You can't heal the gut if the whole system is out of whack. Okay, so moving on. If that gastritis just doesn't quit, lasts more than a week or two, or keeps coming back, now we're in chronic territory.
Right, so supportive care isn't enough anymore.
Exactly. Now the game changes. We stop just managing symptoms and start hunting for the why. What's the actual underlying cause? The diagnostic process gets, well, more involved.
Starting with the basics, I assume. Blood tests, that kind of thing.
Yep. Baseline screening first. Blood work is key. Look for inflammation markers, check hydration again, rule out big systemic issues like kidney or liver disease. Your analysis helps confirm kidney function too.
And don't forget poop tests.
Absolutely. Fecal testing is vital, simple, but you can find parasites like Giardia, Coccidia, even the specific stomach worms like Olalanus. Finding those is great because they're treatable causes of the inflammation.
Okay, so blood, urine, fecal.
Mm-hmm.
Ruled out parasites. What's next? Looking inside somehow.
Imaging, usually. X-rays can spot foreign objects, maybe big structural changes.
Like a blockage.
Yeah. But ultrasound is often more useful here. It lets the vet actually measure the thickness of the stomach wall.
Ah, thicker wall means more inflammation.
It's a strong indicator, yes. A very helpful clue for chronic inflammation. If ultrasound isn't an option, contrast X-rays can sometimes help see blockages or check how well things are moving through the gut.
But you mentioned earlier the only way to be truly sure about chronic inflammation is endoscopy and biopsy.
That's a gold standard for chronic cases, yes. The endoscopy gastroscopy technically lets the vet put a camera down there and see the stomach lining directly. Look for redness, little erosions, actual ulcers.
Seeing is believing.
It helps, but the biopsy, taking that tiny tissue sample while the cat's under anesthesia, that's the only way to know precisely what kind of inflammation it is.
Like those complicated names.
Yeah.
Lymphocytic, plasmacytic.
Yeah.
Eosinophilic.
Exactly. Those labels tell us which inflammatory cells are causing the trouble. Is it mostly lymphocytes and plasma cells, suggesting maybe an immune reaction or food sensitivity? Or is it eosinophils, pointing more towards allergies or parasites? Knowing that difference is critical.
Because it completely changes the treatment plan.
Totally. Tells you if you need a diet trial or maybe antibiotics or even drugs to suppress the immune system. Without the biopsy, you're often just guessing.
Okay, it's becoming clear why this is complex. The list of things that can cause gastritis seems huge. It can be the main problem or just a side effect of something else going wrong.
It really is a long list. Let's start with non-infectious causes. Probably the most common is just eating stuff they shouldn't.
Dietary indiscretion, the fancy term.
Right. Raiding the trash, eating spoiled food, a sudden diet change, maybe getting into fatty human food. Then you've got physical blockages. String is a classic. Bits of toys, plastic, even just huge hairballs.
And toxins too, right? Things around the house.
Definitely. Cleaning products, certain houseplants can be poisonous, even some medications if used incorrectly or for too long. And NSAIDs, the pain relievers, and some antibiotics can be rough on the stomach lining.
And then there are the big underlying illnesses.
Yeah, gastritis often pops up secondary to other major issues. Liver disease, kidney disease that leads to uremia, which is toxic buildup, hormonal problems like diabetes, pancreatitis, all can trigger stomach inflammation.
Wow. And you mentioned stress. Can stress alone do it?
It absolutely can. We see it clinically. High stress levels can definitely irritate the stomach lining in some cats. And unfortunately, cancer in the GI tract is also on the list of causes.
So non-infectious covers diet mistakes, blockages, toxins, other diseases, stress, cancer. What about infections?
Infections, too. Bacteria like Salmonella, maybe Helicobacter, which we'll talk more about. Viruses can cause it.
Yeah.
And various parasites, as we mentioned.
Okay, so given that massive range from eating garbage to kidney failure to bacteria, it totally makes sense why diagnosing the chronic cases needs that deep dive.
Exactly. And speaking of systemic illness, that link between kidney disease and gastritis, that's where some of the most interesting and practice-changing research is happening.
Right, this was the paradox you mentioned. Cats with chronic kidney disease, CKD, they're notorious for vomiting, not wanting to eat. And the traditional thinking was always uremic gastritis, right?
That was the dogma for decades. The idea was that kidney toxins circulating in the blood cause stomach ulcers and too much acid. So standard practice, give them acid blockers, gastroprotectants.
Makes sense on the surface.
It did. But recent studies actually looking at stomach tissue from CKD cats' biopsies, post-mortems, they found something surprising.
No ulcers.
Largely no. Unlike humans and dogs with kidney failure, these cats don't typically show those classic signs of uremic gastropathy, not the widespread ulcers, the swelling, the bleeding we assumed was there.
Whoa. Okay, so if it's not the classic ulcer picture, what did they find in the stomachs of these CKD cats?
Two main things stood out. First, fibrosis. Scarring, basically, in the surface layer of the stomach lining, found in like 43% of the cats studied.
Okay, scarring. What else?
The second, mineralization. Actual calcium deposits forming in the stomach lining. This was found in about 38% of them, and interestingly, almost only in cats with moderate to severe kidney disease.
Mineral deposits. like hard water scale, but in the stomach. Why would that happen?
It's because the failing kidneys can't regulate minerals properly anymore,
Mhm.
especially calcium and phosphorus. When the levels of both get too high in the blood, they can exceed a threshold. We call it the calcium phosphorus product, or CPP.
Okay.
When that CPP gets high enough, the minerals literally start precipitating out of the blood and depositing into soft tissues. The stomach lining is one place it happens.
Okay, this feels like the real aha moment. If the damage in CKD cats is mostly scarring and mineral deposits, not acid burns and ulcers, what does that mean for how we should treat their vomiting and nausea?
It means our go-to strategy might be wrong. It strongly suggests that the vomiting and poor appetite in many CKD cats isn't primarily caused by direct damage to the stomach lining itself.
So what is causing it then?
It's more likely the uremic toxins circulating in the blood acting directly on the vomiting center in the brain.
The nausea signal is coming from the brain, not the stomach itself.
Exactly. So the implication is maybe routinely reaching for acid blockers or stomach-coating agents like sucralfate isn't the best first step for every vomiting CKD cat.
Unless there's obvious bleeding.
Right. If you see melena or blood in the vomit, that's different. You treat for ulcers. But otherwise, it might be more effective to focus on drugs that target that nausea center in the brain. Anti-nausea drugs, basically.
Wow. That really does flip the script on decades of treatment.
It's a significant shift in thinking based on looking at the actual pathology.
Okay, let's shift gears to another puzzle. Helicobacter. We know H. pylori in humans is famous for causing ulcers. What's the deal with Helicobacter in cats?
Well, it's incredibly common in cats, like really common. Some surveys find it in practically 100% of shelter cats and anywhere from 30% up to maybe 100% of pet cats too. Usually it's the large spiral types like Helicobacter felis. H. pylori itself is actually rare in cats.
Up to 100%. That's wild.
Yeah.
But just because it's there doesn't mean it's causing problems, right? That's the mystery.
That's the core issue. High prevalence, but uncertain significance. Loads of cats have Helicobacter in their stomachs, but show zero signs of illness.
Even if you biopsy them.
Even then, you might find some mild inflammation, often lymphocytic gastritis, but the cat seems perfectly fine. The link between having the bacteria and actually being sick is, well, it's weak. It makes it really hard to say definitively, this bacteria is the problem, we must treat it.
So, deciding whether to treat is tricky. And if a vet does decide to treat a cat that clearly is sick and has Helicobacter, sounds like the treatment itself isn't straightforward either.
No, it's pretty intense, and honestly, the results are unpredictable. The recommended approach is often called potentiated triple therapy.
Triple therapy? Sounds serious.
It is. It usually involves combining two different strong antibiotics, maybe amoxicillin and metronidazole, for example, plus an acid-reducing drug like omeprazole, all given together for 2 or 3 weeks.
Wow, that's a heavy-duty combo.
It has to be. These bacteria are tough to get rid of. They hide out in the stomach lining.
And even with that aggressive approach, does it always work? Is eradication guaranteed?
Unfortunately, no. Eradication is difficult. One study found about a 74% success rate in clearing the bacteria initially.
Okay, not bad, but not perfect.
But recurrence was pretty common later on. Either the original infection wasn't fully cleared, or maybe the cat got reinfected from the environment or another cat.
So you might have to retest later to be sure.
Yeah, confirming eradication usually means doing follow-up tests, like special fecal tests or maybe even another biopsy, weeks after finishing the treatment to see if it actually worked long-term.
It's complicated. Okay, we've been through recognizing signs, managing acute cases, diagnosing chronic ones, and these complex causes like CKD and Helicobacter.
Right.
Let's shift to prevention. What can cat owners actually do to try and minimize the risk of gastritis in the first place?
Prevention really starts with the basics. Diet management is huge.
Quality food consistency.
Exactly. Feed a good quality, balanced diet appropriate for the cat's age and health. And crucially, if you do need to change their food, do it slowly. Gradually mix the new food in over several days to even a couple of weeks.
Not just switch overnight.
Definitely not. Sudden diet changes are a really common trigger for acute gastritis. Give their stomach time to adjust.
Makes sense. What about their environment? Keeping them out of trouble.
Yeah, environmental control is key. Basic hygiene, obviously, but also cat proofing. Keep cleaning supplies, pesticides, human medications, anything potentially toxic locked away or out of reach.
Trash cans too, probably.
Oh, definitely secure the trash. And controlling access to potential hazards outside if they go outdoors. Roaming cats are much more likely to eat spoiled things, encounter toxins, or pick up infections and parasites.
Right. And then there's just general preventative health care.
Yep. Regular vet checkups are important. We usually recommend every 6 months, especially as cats get older. Keep up with recommended vaccinations. And talk to your vet about appropriate parasite control deworming schedules, flea and tick prevention that might also cover internal parasites.
And you mentioned stress earlier as a trigger. How
Uh,
do you manage that?
Minimizing stress is important, though sometimes easier said than done. Try to keep the home environment calm and predictable. Provide outlets for their natural behaviors, scratching posts, climbing trees.
Playtime.
Absolutely. Lots of interactive play. It provides mental and physical stimulation, which is a great stress buster for cats. A bored cat can be a stressed cat.
Good point. Okay, so diet, environment, regular vet care, parasite control, and minimizing stress. Seems like a solid plan. Hashtag tag outro opera. All right, that brings us towards the end of this deep dive. So, quick recap. Feline gastritis. We know the signs to watch for vomiting. Maybe that hypersalivation, changes in appetite, potential pain.
Right, and acute cases, if not severe, often get better with just supportive care, like the temporary fasting. But the chronic cases, the ones that linger or keep coming back,
They need the full workup. Imaging, blood tests, and often that crucial biopsy to figure out the real underlying cause from that huge list we discussed.
exactly. And perhaps the biggest takeaway, especially for owners of cats with kidney disease, that CKD paradox.
Yeah, the evidence is shifting, suggesting that for many CKD cats with GI signs, maybe jumping straight to ulcer meds isn't the answer.
It might be more about managing the nausea signals coming from the brain, likely due to those uremic toxins, especially since the stomach damage often looks more like mineralization and scarring, not classic ulcers.
Which leads us to a final thought for you, the listener, to chew on. We talked about Helicobacter, this bacteria that's super common in cats, potentially in almost all of them in some groups, but often doesn't seem to cause obvious illness.
Yeah, and treating it is complex and not always successful.
So the question to ponder is, given how prevalent Helicobacter is, yet how uncertain its role as a disease causer often seems, how does that change how we should think about what's normal versus what's a pathogen in a cat's stomach? What does that complexity mean for deciding when, or even if, to launch that aggressive treatment? What stands out to you about that?
Definitely something to think about. The line isn't always clear.
Indeed. Thanks for joining us to explore the intricacies of feline gastritis. We hope this helps you on your learning journey.